Madam Speaker, my question is to the Minister of Health. This government purchased an incomplete hotel at Hogan Court on the premise that it was ready to be a health facility. Turns out a hotel is not a hospital, as several architects had suggested. And stuck with millions of renovation cost overruns, the government announced last year they would sell the building to Shannex. Then from
Order. There's a member eating in the chambers. I asked that they not eat. They're not allowed to eat in the chambers. I recognize the honourable member for Halifax Halifax Armdale.
Okay. Then money allocated from housing, this government let Shannex the money in order to purchase the building. Not sure what the interest rate, but it doesn't really matter. Today, we learned that not only will they be able to charge back the mortgage costs, essentially giving a private for-profit building free. They stand to make over $11 billion over the life of this contract. How can the government possibly justify this gross misuse?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. I thank the member for the question. So certainly West Bedford has been an incredible opportunity for Nova Scotia to create a new environment where people who need restorative care can actually be reconditioned and transferred home. As I've said, the value in this project is yet to be realized. In 10 weeks, since December 10th, whatever that is, since it's opened, that it has saved 2,166 bed days. 80.6% of the individuals that have been transferred to that facility have actually gone home to community in order to live the remainder of their time. It is a first in Atlantic Canada. We are very proud of what's happening. The value not only to the people.
I recognize the honourable member of Halifax Armdale.
My supplemental is simple, including the purchase price, the easement cost for access to the building, the renovation costs, and the cost of the sole source Shannex contract. What is the total cost for Hogan Court to taxpayers, and will this government make it public?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. So just to continue, the value of this project is to really support not only the people who get care in that facility, but the difference that it's going to make in our emergency rooms, in our EHS response times, in our ability to perform more surgeries, in our ability to care for people with the right time, in the right place, with the right provider, is actually priceless. Thank you.